Methadone, an opioids drug. It's used to treat people with extreme pain, ideal for heroin addicts who want to kick their habit without the agony of extreme withdrawal symptoms and cravings. New clients start on a 15 milliliter dose a day in a pill or liquid form under strict supervision. Methadone can be taken ideally for 12 months, but some patients may require treatment for years.
So they're basically all opioids. It also depends on preference.
Tshwane has 17 clinics, mostly around townships, treating over 800 people. Most people who come to centers like these can't afford the treatment. This 32-year-old has been on the treatment for 2 months.
Every time when they need us, they find us. But at that time when I was on the street doing, sort of, I didn't know what I was doing. It was hard, you understand. But since I've been here, everything is simple.
Reflecting on the hardships brought by years of addiction, the beneficiaries say taking methadone is a step closer to restoring their dignity.
I've been in the drugs for 13 years. So since I started this program, a lot of things change. Because now I'm living like normally. Before I hit the street, I can wash myself.
The drug has been used for decades globally to treat people who are addicted to heroin. Methadone must be supported by psychosocial services.
They are seen by psychologists and social workers to also address one of the biggest parts of substance use problems, which is social and psychological.
The drug aims to help addicts recover from their addiction.
These drugs, a lifeline for many who are battling heroin addiction. It has made the struggle to kick their habit much easier. For others, the program is an opportunity to turn a new leaf and restore their dignity.
This is true for this university dropout, a recovering heroin addict. He has been clean for a while now and works as a peer leader at the center. His biggest challenge, the stigma attached to drug addicts.
I've actually been turned away at a particular hospital where I was treated for 3 days. And on my second day, because I'm dependent on methadone, I requested it. And if you're going to request methadone, it automatically means that you are on a particular substance. So that actually worked negatively against me. So upon requesting such a treatment, I was neglected.
The drug has few side effects like constipation and fatigue. Even children and pregnant women can use it under strict observation. Beneficiaries can't use methadone with heroin, which is a deadly mix. Although the center can't provide exact recovery statistics, staff claim that many lives have been restored since the treatment started in 2016. Some people have even been reunited with their families. For addicts who have lost all hope but want to recover, the COSUP program might just be the solution. Patricia Vasagie, SABC News in Pretoria.
Well, staying with this story, Patricia Vasagie also spoke to one of the experts from the University of Pretoria who's part of this community-orientated substance abuse program, or COSUP. Professor Yanni Hugo, who heads the program, says the methadone program has changed many lives, but unfortunately it's a very costly initiative.
This is a community-oriented substance use program that is based on international scientific evidence, which uses a harm reduction approach and is also built on a human rights approach. We say it's emancipatory, it helps people to manage their lives and take their decisions. And we started it in 2016 with the City of Tshwane, and it includes, amongst other things, methadone treatment, which is a heroin substitute, which is used to help people to stabilize their lives. It's a huge program. We've got 17 sites. We have thousands of people that we've seen. We've got close to 1,000 people on opioid substitution, and it's the only such program in the country that's done on such a large scale.
Why the University of Pretoria, some may ask? How exactly does the City of Tshwane, of course, work with the university? How did that come about?
We have been working with the city since 2011 with the city on community-oriented primary care, community health workers in the communities, etc. And during that time, we realized the problem of substance use. So when the city then did a study on substance use, they asked us to come forward with a scientific approach of an intervention. And that is when we did the research and came up with this approach.
Prof, can you maybe just more or less give us an indication, how bad is the situation out there?
I think what is particular about Tshwane is that the proportion of substance users that use heroin is very high. Where in Cape Town, for example, there is more tick and methamphetamines, etc. So we say Tshwane is the heroin capital of South Africa. So many people are using heroin in the form of Nyaope, smoking it, but then we also found that many of them go to injecting. So there are many people in Tshwane who inject heroin and all the complications that go with that. And that is why we had to focus quite heavily on heroin addiction and the methods that's appropriate for that.
How many people do you know of perhaps have a success story to tell?
We have hundreds of success stories. Most people do find some improvement with engaging with us, even if we don't have funding to give them methadone, through the group work, etc. that we have. Many of them do fall back, like with managing substance use. Falling back is part of recovery. But many of them found jobs, they went back to their families, they could continue studying, and many of them actually put their lives together. And that is what we regard as success for the individuals and the families. The fact that the city, despite financial difficulties, continued to fund this project is already a success. Many of them now understand that the harm reduction approach is actually a relationship approach.
Just so that our viewers have this clear, the program is not only for homeless people. As you have said earlier, there are walk-in clinics. Basically, it is there for anyone that is battling a drug or rather substance addiction, just to put that clear so that people understand that.
Yeah, no, actually, the people who are still at home have got the best chance of success. So we want to help people while they are still in their families and still in their homes. People who are homeless have a serious challenge to be managing their life without support of a family.
And what are the challenges with running such a dynamic program with all the other social ills that obviously come with drug addiction?
Obviously stigma is an issue, because for some part of society we are working with people who are the criminals. For us, they are our clients, they are people that have got potential. The other problem is cost. At the moment, the price of methadone in South Africa is 10 times more than in many other countries. So the cost of methadone is a serious problem.
What exactly is the issue that makes it so expensive?
First of all, methadone is not on the national medicines essential drug list for long-term use. And then it means that there wasn't a contract for that on the state tender. We've now worked to get that put right, and we are very close to getting methadone on the essential drug list. And then it's a matter of we have to find ways of creating competition, or we may even do like we did with the HIV medicines, have a specific intervention to make it affordable.
How much does it cost per annum to administer this program?
We have a budget round about 30 million a year for everything.
What's your hope for those who are battling substance addiction?
The most important thing is they should have access to a place where they can go, where they will have an understanding team, hearing their story and assisting them on the way back to life. And that we have in Tshwane, but we need much more access for people to that type of service.